and I'm specifically going to be teaching you about the FAST scan because a few people have asked me about how to do it, especially being on A&E, and certain surgical trainees also were really, really interested in it. So I thought I'd, this year, focus a little bit more on it since I'm doing A&E as well, and also so that some of you, maybe when you're on your A&E attachment, you can start to use these skills. So has anyone got any experience in emergency ultrasound or done fast scans or done anything with an ultrasound? No, so that's perfect. So this is going to be quite basic. It's going to be a lot, but it'll be quite basic. So the aims of today is for me to tell you or give you the theory of how to be able to perform a fast scan and how to interpret it. So to break it down into the learning objectives, you need to know the indications for why you're doing the fast scan in the first place. You need to be able to pull out the right probe and then position it appropriately on the body and know which view you're getting. Be able to identify the landmarks on that view, and then also be able to recognise what's abnormal, so whether you can notice that there's free fluid. So, ultrasound, what is it? So it's basically just electrical energy that goes through a piezoelectric crystal, and it changes it into sound waves. And then the sound waves are either dispersed, absorbed, or it reflects back by tissues, and then it goes back through the piezoelectric crystal, and then becomes electrical energy, and then you get your image. So one tip is that you have to try and remember this: fluid is black. That's one key message. Fluid is black. Okay. So the reason why ultrasound is so useful is that it's cheap, it's portable, so you can use it on unstable patients. There's no radiation, so you can repeat it as many times as you need. It's very specific, so if you see free fluid, it's free fluid. And also, you can actually detect quite small amounts using a fast scan. So the minimal probably amount is about 250 mils according to studies. The cons are that sensitivity can be variable, so it's very user dependent. Also, if you've got basically a fat person, it's very hard to get a good image. And also you get things called artifacts, which are structures that appear on your image that aren't actually there. And that can affect how you interpret the image, basically. But they can also be quite useful. So as some of you might have seen on an ultrasound machine, there might be loads of wires and loads of things dangling out. But basically, at the end of the day, there are three probes on it. There's one called a linear probe, one called phase array, and one is the curvilinear probe. And with the probes, you need some gel, because they say air is the enemy of ultrasound. So if you just put a probe against the skin, it's not going to actually transmit the sound waves through. So you always need gel there. And one key thing is that a low frequency probe, so if it's sending out low frequencies, it penetrates into the body more deeply, but the image quality is not as clear. So I'll just very quickly talk about the probes that you'll see. So there's one that looks like this, it's straight, and on the image, on the screen, it will look straight like this at the top. It will look like either a square or a really long rectangle, and that's your linear probe. And it's a high frequency probe. So like I said, it's the opposite of the low frequency. So you will see more superficial structures, but you'll have a really good quality image. So my tip is to use that on superficial areas like the limbs. If you want to put in a cannula under ultrasound guidance, use this. Then you've got your phased array probe as well. And if you notice, it starts off with a triangle, and that's because it's got a really small footprint. And basically, this is really good for using on the heart, because you can scan in between ribs, and ribs causes shadows, and you can't see past those ribs. So this just helps to get in between them. So use it on the heart. But lastly, which is the most important for you for fast scanning, is to use the curvilinear probe, which is a low frequency probe between 3 to 5 hertz. And basically you use this for your abdominal organs. So it goes deep, but the image quality is not as clear as the other two. So the FAST scan stands for Focus Assessment with sonography in Trauma. and it's used to identify fluid. But in trauma, you're going to assume that this could be blood. And the three places that you can see blood are around the lungs, so in the pleural space, around the heart, so the pericardium, or in the abdomen, so the peritoneum. We're now trying to move towards extended fast scans. They're called e-fast, and that just includes extra views where you put the probes on the chest and you try and rule out attention pneumothorax. But the four classical views that you'll use on a fast scan is the right upper quadrant, left upper quadrant, suprapubic, and subxiphoid. Those are the four that you need to use. So when do you use your fast scan? Mostly in trauma patients. They can either be stable or unstable. But basically what this tells you is that if you don't see any fluid, it doesn't necessarily rule out a bleed. So just because it's negative, I did a fast scan, it's false negative, it doesn't mean that that person's not bleeding. So you still have to clinically judge them and decide whether you need surgical input or a CT. It's a good adjunct for the using a CT though. If you see free fluid, then you'll push them to a CT scan or straight to theatre if they're very unstable. So the first view is the right upper quadrant, and that's exactly where you would put the probe. And if you look at that green indicator, it's on every single probe. And you usually, when you're scanning, you have to put it either, the rule is, towards the head or towards the right. So never put that indicator towards the left or to the feet. So if you imagine you put your probe exactly how it showed in the picture from here to here, this area here is where the probe would be. So this structure here is the first thing it would hit, so it's near the ribs. Can anyone tell me what this arrow would be then underneath the ribs? So this is head, this is foot, and that's rib. Can anyone tell me what this arrow is? No. And don't worry if you get it wrong, because if you get it wrong, it's probably what everyone thinks it is too. So it's not kidney, liver, yeah, exactly. And what's this structure? So this is, remember, this is head, this is foot, and that's the side. What's this structure above the liver?
Diaphragm.
Diaphragm, exactly. And then this structure is your kidney. So what you're looking for in the right upper quadrant is, which is actually the most sensitive area for picking up fluid, is the space between the kidney and the liver. And this is called Morrison's pouch. It's the most sensitive place to find free fluid, especially in a supine patient. But there's two other places you can look, and you must look, which is above the diaphragm, so the pleural space, and also remember head, feet. So this is the bottom tip of the liver, and that's the other place that you'd see it. So here's a test for you. I'll give you a clue. Fluid is black, right? Can anyone tell me what's abnormal here? Fluid is black. Can you see black? Okay, where is the blackness? And try and identify your landmark. So what's this?
Liver.
Yep, exactly. And what this was on top of it? Diaphragm, exactly. So this funny thing floating here is? Yeah, exactly. So this would be fluid, exactly. But if you notice, if you track round the diaphragm and you track round the liver, there's also some black here. So that's your fluid. So there's both fluid in the thorax and the abdomen. So the left upper quadrant is virtually the same as doing the right upper quadrant. So what would this be if it's on your left side? Yeah, exactly. Kidney, if you're getting it. So diaphragm. Except on the left upper quadrant, the most likely place to find fluid is actually around the spleen, rather than between the kidney and the spleen. It's around the spleen. You can also get some between the kidney and the kidney and the spleen, and you can also see if there's any in the pleural space. So I'll spoil the surprise. This is abnormal, and there's black. So that's the spleen, that's the diaphragm, and that's fluid. So this is your suprapubic view. I'm going to show you what it looks like on a female. So the next image I'm going to show you is normal. So if you can imagine where that probe is, it's next to the skin going down. This is where the probe is, head, feet. What's this? It's a normal scan. Bladder, yeah, exactly. And then what would this be? Yeah, uterus. And then on women also, following the uterus, you'll see a bright line, and that's called the vaginal stripe. So typically, you'll find fluid in the pouch of Douglas, which is behind the uterus before the rectum. And if it's a male, it's behind, because they don't have the uterus there, they'll have fluid between the bladder and the rectum. So the last view that you need to know is the subxiphoid. And you use the liver as an acoustic window. So just basically that means it gives you a better image. So you're pushing it underneath, flat, sorry, you can't see, flat, and up like that. So the next image, what would that be? The top arrow. You're using something to help you see it.
Liver.
Yeah, liver. So then if you imagine your probe is going that way, looking that way, up through the heart, what's the first thing it would hit? What's this arrow? Most inferior part of the heart. Someone have a guess? Any idea? Inferior. So if someone stabbed you up that way, the first part of the heart it's going to hit is the right ventricle. And then this area here leads into that, so that must be the right atrium. If that's the right ventricle, this is quite a big chamber, that's your left ventricle. And then this chamber leading into the left ventricle is the left atrium. And the most sensitive part for finding pericardial effusions would actually be the inferior part, because gravity helps the fluid go down, and that's where you would look for fluid. So, can you tell me if this is normal or abnormal? It's a bit difficult because it's not moving. Abnormal, yeah, exactly. So the fluid is actually here, and this squashed thing here is the right ventricle. So I'm going to test you and see if you can tell me what view is this. What view would this be? So it's around this structure. And if you imagine this is probably where the kidney is, this is diaphragm. So that would be left upper quadrant, because it's most commonly around the spleen. I'm really sorry, this is not the best video, but can you hazard a guess what this would be? It's kind of telling you superior, inferior. Can you see black? Where can you see black? Try and describe. Can you see this black bit here? And then there's something here as well, and there's some black here, and which is continuing here. So what view do you think this is? Yeah, exactly. So that's a uterus floating around in some free fluid, and that's the bladder. And then this, what's this view? Yeah, exactly, it's the right upper quadrant. So you've got your kidney here, your diaphragm, which is really bright, and then I mentioned before there are 3 places in the right upper quadrant. So you've got your Morrison's pouch here, pleural space, but then you've also got that tip of the liver. That's actually called the shark fin sign. You just see it flapping away in the free fluid. And lastly, can anyone tell me what is this? Yeah, so this is actually cardiac tamponade, because where it's frozen here, the heart is in diastole. And can you see how the right ventricle is kind of bent inwards? That's called scalloping. So the pressure outside is greater than the pressure inside. And in diastole, you should see it coming out quite nicely. So the So this is actually cardiac tamponade. So in summary, we've discussed about what ultrasound is, what probe you have to use, and where you should put it, and the landmarks. And hopefully you should know vaguely now what's normal and what's abnormal. Black would be abnormal, except if it's in the bladder. Remember that if it's a positive scan, it's also free fluid. So it might not be blood, it could be something like ascites, so you have to actually just judge in that circumstance. If it's negative, it doesn't rule out the fact that you could be bleeding, so you might still need a CT, a surgical opinion. The CT still remains as your gold standard. And the other thing to remember is that it doesn't show retroperitoneal bleeds. So if you're looking for a leaking AAA, then a fast scan won't actually show you that answer. You'd have to do a separate AAA exam. So now hopefully you'd be able to go out and practice. Apparently it takes about 10 goes on a scan to stop any, to create a stable error rate. So does anyone have any questions? Yeah.
It feels like on AIM you do a lot of fast scan scoring, or like as well. What will they be looking for?
So I don't think that, so there's two bits to this. I don't think it's, or I think when they say that they're doing fast scan, they also do a AAA exam as well. So they'll look at those views and then also study the aorta. The other thing is it's still useful to know if there's fluid elsewhere, is this person bleeding from elsewhere, if they're hemodynamically unstable and have a rigid stomach or distended abdomen, then it would still be useful to do a fast scan in that circumstance. Anyone else? Okay. So it's to basically follow up from this session. If anyone's interested, I need to follow up by doing a practical session. So it would be just 10 minutes on an ultrasound probe, probably in A&E with that ultrasound machine there. I need one volunteer who'd be happy to be scanned and get their belly out, and then 2 people who'd be willing to do the scan. If you're interested, just email me